Next slide, please. Welcome to the Children's Environmental Health Series, and welcome particularly today, October 8th, which is the National Children's Environmental Health Day in the United States. My name is Barbara Sattler. I'm a professor emeritus at the University of San Francisco and a board member of the Alliance of Nurses for Healthy Environments. And that organization is sponsoring this webinar series. Next, please. The Alliance of Nurses for Healthy Environments is a now international organization that is made up of nurses from all walks of nursing life who are interested in environmental health. We have school nurses, public health nurses, hospital-based nurses, advanced practice nurses, faculty, etc. So we welcome you to explore our website. Next slide, please. And learn a little bit more about us. You see in green here, this is the URL for the Alliance of Nurses for Healthy Environments. We have nurses all over the world, as I've said. We work through work groups that meet approximately every month via Zoom or other meeting modes. And they are our education committee, our practice committee, our research, and our policy and advocacy committee, or work groups rather. We also have committees. We have a big international committee on climate change, one that's more focused on energy and specifically fracking, and then a relatively new one on food and agriculture. So if any of this looks interesting to those of you who are on the webinar today, we welcome you to sign up for the EnviroN newsletter. Let us know what you might be interested in, and we'll make sure that you're getting continued information. I do know that today we may have some non-nurses on, and we welcome you. And just so that you know, we are evidence-based professionals, and so everything that we'll be presenting today, we hope that you will be able to utilize as moms and family members, as people who are concerned about children's environmental health. So over the course of this webinar series, we will be looking at children starting preconception and then moving through till early adulthood. Today, we're going to be focusing on the perinatal period. So that's preconceptual, conceptual before, and then immediately after birth. And so next slide, please. This is a period of time of...
Barb, this is Hannah. Stop for a second. Can anyone hear me? Can you put in the chat box? I have a couple chats that participants were unable to hear you. Are people able to hear Barb? Okay, they can hear both just fine. Okay, thank you all. Resume, Barb. My bad.
No, you're fine. We want to make sure people can hear us, so thanks so much. And it looks like some people are hearing through the phone. As long as you can hear at all right now, we're going to take that. Please note that we're going to move through the speakers and then have questions and answers at the end. You can start putting your questions in the chat right now under attendee chat, and I'll be moderating the chat and the questions and answers at the end. So going back to my slides here, this is everyone's first environment. And so what we're going to be talking about today are some of the health risks that are associated with environmental exposures, which may be chemical, biological, or radiological. Next, please. When I went to nursing school, which seems like it was in the dark ages, we actually thought the placenta was fairly protective of the embryo and the fetus. And what we have discovered is that a great many toxic chemicals go right through the placenta. And we know this because we know that newborns have circulating in their blood, and Alexa will talk about this, a whole range of toxic chemicals that they actually were exposed to in utero while they were developing. We also used to think that the blood-brain barrier was another functioning protective measure. And we've discovered that a great many toxic chemicals go right through the blood-brain barrier. And that's both in utero as well as throughout our life. And so these two protective measures are not protecting us very much. And so very important then that we think about how we're going to prevent toxic chemicals from any of us in terms of exposures. Next, please. Also, we're not going to be talking about breast milk, but I want you to just know that many of the toxic chemicals, particularly those that are what are called lipophilic, meaning these chemicals are attracted to and will form in sort of the solution within fatty tissues. And so those get expressed in mother's breast milk. So in addition to chemicals crossing the blood-brain barrier, crossing the placenta, they also cross through the breast and into the breast milk. Next, please. As nurses, when we study pharmacology, we learn how to do dose responses, or doses rather, and estimate what the doses should be for our pediatric patients. So there are a number of formulas that we use. However, I'd like you to think about how we even can think about what are the safe doses when we're dealing with known toxic chemicals when it comes to the fetus. We know that we use very, very, very small doses for our, infants. Well, what about when all the cells are just beginning to form into organs? What's a safe dose of a toxic chemical at that point? Next, please. One of the things that we're not going to be talking about too much today, but I want everybody to consider, is as we work with our patients who may just be considering becoming pregnant, or young couples, and when they are pregnant, that we do a really good job about asking them where they work and what kinds of exposures they might have in their workplaces. Doing a good occupational health history as well as environmental health history will help give us some insight into what kinds of exposures both the man and the woman may have that can create fertility issues or can create health risks to the embryo and fetus. Next, please. So some of the questions that I'd like you to consider over this next hour is, how can we actually get serious about doing our environmental health assessments as nurses with our patients, and then providing them with effective recommendations for reducing exposures? And then even further upstream, how do we prevent these toxic exposures in the first place? Can we really just shop our way to less toxic exposures, or do we need to do more? And what in the policy arena should we be involved in? And I love that we do have people from moms groups that are on today, because I think nurses and moms working together could be a powerful, powerful coalition to look at toxic chemical exposures. Next, please. So I'd like you to stay tuned. Everybody who is on this webinar today will be getting an email for our future webinars. They will be happening approximately every 2 weeks. We've got a little extra time in there around the elections. We have nurse experts who have done research on pesticide exposures during pregnancy. We've got a session that's going to look at fluoridation, especially during the perinatal period, and what the new science is saying, and a great many more things. And so with that, I'm going to end my introduction, and I'm going to introduce Alexa Curtis. who is an associate professor at my university, the University of San Francisco. She's a nurse practitioner. She has a master's in public health, where she took an environmental health course. Most nursing schools do not include a whole course in environmental health. And so Alexa has done a bit of a deep dive into this, and she's going to be talking about perinatal period and what are very common exposures that women may have during this period. And with that, Alexa, thank you so much for joining us. And also, she's the assistant dean in the graduate nursing program. And I think I said you're an associate professor, but you're a professor. So I apologize for that. You are on, Alexa.
Well, thank you, Barbara. Thank you for that kind introduction. And yes, I'm happy to be here. Go ahead to the next slide. So in the 20 to 25 minutes we have here together, we're going to do a review of the special vulnerabilities of the embryo and fetus. We're going to identify common environmental exposures in everyday exposures in pregnant women and the embryo and fetus, and discuss the application of evidence-based practices to mitigate the risk of potential toxic exposure to your patients. And I am likewise so glad to hear we have community members in the audience, so exposure within your families and your communities. Next slide. So I have no disclosures for this presentation, and but a huge acknowledgement. Dr. Sattler, who was just speaking, has been my personal mentor, as well as a mentor for many nurses that are interested in environmental health. She has been instrumental in integrating environmental health education in our Doctor of Nursing practice at the University of San Francisco, and we are all incredibly grateful to her. She continues to be my mentor and my tutor on many things in terms of toxic environmental exposures. So next slide. So, and I will fill in with that. Actually, my contribution, building upon Barbara's, is I'm a practicing nurse practitioner. I work with patients, on a weekly basis, and my frame is how do we make this very, very important and sometimes complex information accessible to our patients and our communities. So the big picture that we have here is that environmental exposures, toxic environmental exposures, cause significant morbidity and mortality throughout the world. And this is a talk focused on perinatal health, but I cannot help but throw in a recent research that came out of Stanford that estimated that there were 1,200 excess deaths and 4,800 excess emergency department visits in California between August 1 and September 10th related to wildfires. Now, that wasn't among an older adult population, but we certainly can extrapolate to what that type of exposure does to all of us, particularly our most vulnerable. Next slide. And as nurses, we need to be we should continue to be aware that we are always working toward meeting the national health objectives, the Healthy People objectives. So you notice we've moved from Healthy People 2020 to Healthy People 2030. And there are a series of environmental health priorities in the Healthy People 2030 objectives. So this is great news. This is, the outcome of work of people like Barbara, who are pushing this discussion forward of the need to make policy changes in order to improve the health of individuals and populations. Next slide. So what we'll start with here is arsenic. So arsenic is a naturally occurring inorganic compound found in the soil. It's also the byproduct of mining and ore smelting and other industrial processes. It enters the groundwater, and this is the most likely route of exposure is through drinking water. It is a known carcinogen, and it has significant effects on reproduction, including the male reproductive system, in particularly potentially decreasing fertility, and then effects on fetal development and brain development. I will say that in terms of arsenic exposure, for an example, I live in Northern California, up in the old gold mining district, and if you look at what is in our groundwater around here, literally right below my house, they have found arsenic, lead, nickel, and mercury that are present at hazardous levels. And this all comes in my area from mercury gold extraction that happened in around 1926, and then cyanide extraction that happened between the 30s and the 50s. So this is very real, very present, and you can see a map on the slide of the places where arsenic is found in the water. Next slide. So what can we do to reduce our exposure to arsenic for ourselves and our patients? So certainly, since this is an issue of groundwater, we want to test our well water. Test kits are available, as everything else, on Amazon. And what's to be noted is that testing is not mandated after a well is drilled. So I live on a well. We have tested our water. We've tested our water several times. I've raised 4 children here. We've kept an eye on our water. It's recommended, as always, to eat a varied diet, which just promotes health and limits exposure to excessive intakes of any types of contaminant. Of importance is fruit juices. So why fruit juices? Well, any plant that consumes a lot of water has the potential to have arsenic in it. So that's why you see not only fruit juices, but rice, because that's such a water-based plant product. So the recommendation is to limit the fruit juices, and we're doing that anyway, right? So that our kiddos don't get dental caries, obesity, etc. There's still arsenic in the community, so things like pressure-treated lumber, although there have been laws to restrict the use of arsenic, the older lumber can still have arsenic in it. And then be mindful of the potential for unsafe working environments, and advocate for your patients to be sure that they are advocating within their organizations for proper PPE, and advise your patients and your community members, if they live in my area particularly or something like it, to stay away from mine sites, keep their kiddos away from mine sites, or in industrial areas, keep them away from industrial runoff. I will tell you, I did a really good job keeping my kids away from the mine site until they became adolescents. Next slide. Okay, so then the next exposure we're looking at is lead. And lead has been known to lead to male infertility. It is also neurotoxicant, which the effects are to slow growth and development of children. It can cause learning and behavior disorders, and hearing and speech disorders. It is, according to the World Health Organization, it accounts for about 63% of the global burden of developmental intellectual capacity, decreased developmental intellectual incapacity. Sorry. So what's important to know is that there is no safe lead level for children. And in California, children who are on public healthcare plans are mandated to have their lead level checked at 12 and 24 months. But concerning is the LA Times recently reported in January 2020 that 1.4 million children covered by Medi-Cal are not being tested for lead exposure. If the child is not on a publicly funded program, the recommendation is to an assessment and test based on the risk assessment. Next slide. Okay, so things you can do to reduce your exposure to lead are to maintain older homes. Be aware that there is lead in the paint of older homes. Have your water tested. Run cold water in your tap so that you don't run hot water to leach out the lead. You don't use hot water when you're cooking or preparing baby formula. The lead can be tracked in by your shoes because it's in the soil. So leave shoes outside. One thing we've learned during the pandemic is wash your hands. And so that continue those good practices. Stay away from any products that contain lead, such as stained glass. And be alert to lead in imported products like ceramics. And again, just like arsenic, generally eat a healthy diet, which keeps you resistant to, health issues, as well as reduces your exposure for repeat exposure for toxicants. Next slide. So what else can you do? Check your water. Here, you can go on the Consumer Confidence Report and check to see what is in your local water supply. Next slide. Okay, so the next exposure we're going to talk about is mercury. There are two types of mercury in particular that we're looking at: methyl mercury and elemental mercury. So methyl mercury is formed from inorganic mercury, and it can happen through natural causes such as volcanoes, forest fires, and maybe not such a natural cause, the burning of waste. And it's also caused by the use of fossil fuels, particularly coal. And then elemental mercury is what you see in the thermometers. It can be in things like novelty jewelry and dental fillings. So what are we concerned about? Once again, it can contribute to male infertility. It also, in the perinatal period, has been associated with an increased risk in spontaneous abortions and other birth effects. In the female, it is associated with endometriosis and polycystic ovary syndrome, and it can be associated with abnormal lactation. So important to know that 50% of the airborne mercury is coming from our power plants. And then what happens is the airborne mercury settles into the ocean waters. And that is why what we end up is with finding the mercury in the large fish. Next slide. So what you need to be aware of is big fish have more mercury, and there are ways to track what would be a estimated safe fish consumption for yourself and your family. And the tracker that is listed here, the Environmental Health Working Groups tracker, will also include the pregnancy status of your clients and provide a basic guideline of fish consumption during that period of life. Next slide. And then to reduce exposure to mercury in children, again, make sure those old mercury thermometers are not anywhere around. And if they break, call the health department and use proper cleanup methods, properly dispose of products such as fluorescent light bulbs and batteries. And then back to what Barbara was saying is how can we really affect change in, something that is, could be so potentially diffuse as mercury, is to become policy advocates to promote clean energy for the health of your families and children and your patients. And important to note that the type of mercury, the ethyl mercury that is used in vaccines, there's been no evidence that supports that causes a health risk, particularly autism. As that is obviously a concern that we field all the time as practitioners. Next slide. Okay, so now we're moving a little bit more, changing, of course, a little bit more into a product exposure. Bisphenol A, BPA. is a chemical that is found in a lot of plastics. The health risks that have been associated are male infertility, female infertility, decreased prostaglandin, that's what E2 synthesis is, prostaglandin synthesis, and early spontaneous abortions, and then babies born with a smaller head circumference, which certainly would lead to some concerns about neurodevelopmental issues. What is important is that we need to continue to push forward as clinicians and as parents to request that more research is done on the health risks of these chemicals like BPA that we're being exposed to through common consumer products. Next slide. Okay, so perchlorate, it's around our environment through some natural sources, particularly in arid states and through things like fertilizer, but it's also manufactured and in sources, and it comes to our environment through sources like fireworks and road flares. So what's important to know here is that is a significant thyroid toxicant that is associated with a range of reproductive risks. There's a map there that shows you where. So once again, it's a chemical that settles into our drinking water, and that is our primary source of exposure. And there's a map there that shows you where perchlorate can be found in the drinking water. And really, because of the way that it disperses throughout the groundwater and its resistance to conventional water treatment, it has become one of the biggest challenges that we are facing in the drinking water industry. Next slide. Once again, I want to redirect you to our Healthy People 2030. I keep wanting to say 2020, environmental health priorities. And so big policy issues that we need to be working toward as clinicians and community members. Next slide. So air pollution in general, and reproductive health risks. Air pollution, there's a lot of variability in what is in air pollution, but some of the things that we know are chemicals that are endocrine disruptors. We're going to talk about that in a little bit. Reactive oxygen species inducers, what they do is they cause oxidative stress and cell damage. They cause formation of DNA adducts, which are segments of DNA that bind to a cancer-causing chemical and can start the process of carcinogenesis. So high levels of air pollution have been associated with preterm births, increase in mortality, and infant congenital deformities. Next slide. Okay, so what we need to know is that we are, as persons who live in an environment, carrying these chemicals in our body. They aren't just going away. They settle in our groundwater and our soil, and they settle in us. There are ways to monitor for what is settling in us through biomonitoring. Then we have a national biomonitoring program that has a sample of about over 7,000 people, and California has its own biomonitoring program. Next slide. So one project that was looking at biomonitoring, and we pull out this participant particularly to focus on because she is a nurse, found that in this project of the adult study, they found 155 to 171 of the 214 chemicals that were tested, in particular for this nurse. You can see that 54 of the chemicals found are known to be associated with birth defects and developmental delays. And then going down to reproduction and fertility, 23 of the chemicals that were found in this relatively random participant's body were known to be associated with reproduction and fertility issues. Next slide. So it gets in us, and then it is transferred, as Barbara already mentioned in her slide, from us into our children in utero. Next slide. So there are a series of chemicals that are listed here that you can read, that we've talked about several of them so far, that are known to cause some type of significant effect on neonates. Next slide. So how does this all act? These chemicals that we are making, industrial, agricultural, and commercial chemicals, they can actually act like pharmaceuticals. They are absorbed and transported throughout the body. They are can be metabolized into a more reactive agent. Then they can function to mimic or block hormones. They can interact with gene expression, and then once again interact with that very sensitive period of fetal development. Next slide. So what is an endocrine disruptor? It is something that can either mimic a natural hormone, increase or decrease the action of hormones, or alter production of hormones. And the effect of endocrine disruption can be developmental malformations, interferences with reproduction, disturbances in the immune system, and an increased cancer risk. What's okay? Go ahead, next slide. That's good. Yep, go back. You did good. So here are a list of those chemicals that can cause endocrine disruption. One thing that is really important to know here is that some of these endocrine disruptor chemicals, they have an interesting dose response curve, where the normal, dose response curve is sort of an S shape. You have a low effect at a low dose and a high effect at a high dose. So, some of these endocrine disruptors through toxicology studies have been found to have a U-shaped dose response curve, where there's actually a high effect at a low dose, and then the U goes around and a high effect at the high dose, but sort of at those moderate doses, there may be a low effect, which you can imagine could disrupt the knowledge that we obtain from studies of these chemicals if we are not aware of that, the way the curve works. Next slide. So an important concept is the 6 classes of environmental exposures. We've talked about a lot of different chemicals and the names of different chemicals, but really if you break them down into 6 classes, then you can start to really understand their effect on our individuals and communities as a class. So first, I invite you to go on to the 6 classes website, to the Green Science Policy Institute, to receive a more in-depth discussion of 6 classes. But what's really important here is to be aware of regrettable substitutes. So what happens is a chemical is identified, is associated with adverse health effects, and it may be banned. And then what can happen is that it is then replaced by another chemical that is not banned, but is in the same class and has the same or worse effects. Next slide. So important that we have everyday environmental exposures through personal products, household products, occupational exposures, pesticides, food contaminants, drinking water, and climate. We have bandwidth to discuss some of them here, but we need to be aware of them for our patients and our communities. Next slide. The one thing we would go through is cooking and storing. So in terms of cooking, what we want is for our patients to be using cast iron or ceramic cookware that exposes them to less toxicants, using glass, porcelain, or stainless steel containers, and avoiding microwaving plastics. For storing, again, avoiding those plastic water bottles that have BPA in them. Next slide. So fire retardants are everywhere. They, the marketing is that they reduce your risk for a catastrophic fire event, but in reality, there's significant evidence that this was a big marketing ploy, and I encourage you to watch Toxic Hot Seat, which is available through Amazon Prime and HBO. And what that shows is how the chemical industry, pushed fire retardants on the communities, and how that they really truly aren't effective in mitigating the risk of a catastrophic fire event. But what they do is expose us to polybrominated diphenyl and biphenyl esters, which are known to be, go ahead to the next slide, which are known to have significant health effects, from neurodevelopmental effects, endocrine system disruption, and reproductive effects. So laws have been updated, and there are fire retardant options available in things like mattresses. So one of the things that you would want to look for is the TB 117 tag, and that would indicate that there is a fire retardant in it. And the tags, if they are being marketed as toxicant free or fire retardant free. Next slide. Okay, quickly, the last exposure that we're going to talk about is pesticide exposure. So Barbara and I worked closely on a review of EPA regulations in terms of organophosphate exposure. And what's important to know is that organophosphates are used throughout agriculture, and they have been known to be associated with significant pediatric neurodevelopmental outcomes, particularly issues with cognitive function. Another important thing to know is that populations may be affected differently, based on their genetic prototype. So progress is being made. The use of indoor organophosphates was banned in about 2001, things like RAID. And then California has moved to a restriction on agricultural organophosphates. But this is where, when Barbara was talking about doing a really good occupational assessment on your clients, knowing if our clients are, working in a farm working environment, do your anticipatory guidance in reducing exposure to organophosphates, particularly for pregnant women and children under the age of 2. Next slide. So what's important as clinicians, that we assess the client's environment, that we work to educate our clients and continue to educate ourselves on environmental health risks, that we inspire our clients and our colleagues to become policy activists in terms of protecting communities and families, and that we become engaged advocates in environmental health policy. Next slide. So you will do a community assessment. So like I already described, if you lived in my community, you would know that it's agricultural. So we would do a pesticide assessment, and it's mining. And we talked about that. You would do a home assessment. So again, in my community, it was, there's still some pretty old houses. And then there are specific preconceptional prenatal assessments that you can do for environmental exposures. And one assessment tool that's going to be discussed today by the next presenter is the Planned Parenthood Green Choices. So thank you. Oh, and yes, thank you. And feel free to email me if you want to continue this discussion in another forum. Thanks.
Thank you so much, Alexa. And my sympathies go to Alexa, because I know how much there is to share with you folks. And Sarah, if you could bring up Sandy's slide, that'd be great. And how little time we had today, but hopefully that if you'll stay with us for future webinars, that we'll have opportunities to dig a little bit deeper into several of the topics that that Alexa just broached today. And next, I'd like to introduce Sandy Worthington, who is a friend and colleague. She's a board member of the Alliance of Nurses for Healthy Environments. Sandy is a certified nurse midwife. She was very involved in the educational programs of the National Planned Parenthood Federation of America. During that time, she received a grant from the Kresge Foundation to create this wonderful program that I'm so glad that she'll be talking about, Green Choices. And so, Sandy, it is up to you now. Go ahead.
Thank you, Barbara, for that nice introduction and for the opportunity to share a special project that I directed a couple years ago. Next slide. So, Planned Parenthood Federation of America, I worked for them for many years, and my most recent position was Director of Medical Continuing Education. And one of the first projects they gave me was to create a program where we could educate our staff and our clients on how environmental risk could affect their health and what they could do to decrease it. So we, as Barbara said, we received grants, and my first impression was I knew a whole lot about reproductive health, but I didn't know much about environmental health. And whereas many of my colleagues really bought into including environmental health, we all needed some education. So we developed or got a bunch of experts in both reproductive health and environmental health. We convened this 3-day meeting, and most of the first part of it was the environmental health experts educating us on what the issues were and what things they thought we needed to do. So we not only were educated, but then we came up with a plan of action of where we wanted to go with this project. And we developed a curriculum for our staff, and the curriculum was for either an in-person education session or Planned Parenthood has online learning modules so that our staff could take these modules at their convenience. We also developed printed materials for our patients, and anything that we developed was reviewed by a health literacy expert. And then we beta tested the written materials, both on the staff level, at a urban clinic staff, and everything was evaluated by an evaluation expert. And you might wonder, why Planned Parenthood? Well, Planned Parenthood serves about 2.4 million women a year and has over 600 clinic sites throughout the United States. And so we were able to get this information out to a lot of women in their reproductive age, and also women who not only care for themselves, but also their children and their family. After we developed all these things, we wanted to disseminate the information to all the clinic areas or each one of the clinic sites. So we developed these boxes or toolkits, and they had a variety of support materials, including a patient self-assessment form, patient information forms. We included BPA-free water bottles for the staff, posters, flyers, and a lot of other little additions in the toolkit. Next slide. So everybody convened in this expert panel agreed that environmental health education is a part of the Well Woman exam. Next slide. And the experts in environmental health pointed out to us many of the reproductive things that are affected and have a link with environmental toxins. And we've talked about some of these, but of course there's premature puberty, including thelarchy, impaired fecundity, increased incidence of endometriosis, decreased testosterone level and decreased sperm count, increased male gynecomastia, increased incidence of breast cancer, and poor pregnancy outcomes such as spontaneous abortion, low birth weight, and preterm births. Next slide. The group also identified some key areas they thought we should focus on. There's so many more areas that are out there, but we had to make this project manageable. So we zeroed in on air pollution, water contamination, food contamination, harmful substances in building materials and workplaces, consumer products, including personal care products. Next slide. So what we did was we identified 8 areas, and we developed patient information sheets on each of these 8 topics: lead, plastics, pesticides, cleaning products, smoke and secondhand smoke, cosmetics and personal care products, fish and fruit and vegetables. Next slide. Then we developed a patient assessment tool, and we knew we needed to make this relatively simple. One thing is patient visits are so short, and you have so much education to do. And to add even more education onto it, we had to make it simple and user-friendly. So we developed this self-assessment tool, and it was designed so that when the client comes into the reception area and signs in, the receptionist gives them this tool and asks them to complete it in the waiting room. So it's a self-identified risk. So when they get into the exam room, either the medical assistant or the clinician looks at the assessment tool and sees what the client has identified as their risk. And then they address those specific risks. And they all lead back to those 8 topics or 8 patient information tools that I mentioned before. So, a person may not have a risk in lead poisoning or lead paint. So you wouldn't bother giving them the tools necessarily on the lead. You focus on the things that the person has identified that is their own personal risk. Next slide. So these are what the information sheets look like. So as I mentioned before, we tried to make them simple so you could just tear off an information sheet and hand it to the person, go over some of the highlighted areas, and then let them take that sheet home with them. And some typical things on each one of these forms are what you should know about that particular risk, how this can affect your health, what are safe ways to avoid these risks, and where I can get additional information. So for instance, with the pesticides, it says, what are pesticides? How would I have contact with pesticides? What are the risks in contact with pesticides? And how can I avoid pesticides? And where can I get additional information? So that's what we did with all of these 8 particular information sheets. And our idea was to start with these 8 and then expand to other areas that we think people are at risk for. And next slide. So just to recap the Green Choices Project, they have interactive learning modules. They identified common environmental exposure. It provided practical ways to decrease environmental health risk. And it includes reference websites to get additional information. And next slide. And as Alexa pointed out, there are many different health assessment tools. And these are some of the ones you can access on the ANHE website. There's a community health assessment, a home environmental health and safety assessment tool, environmental hospital environmental health assessment tool, a pediatric assessment tool, an indoor air quality tools for school program, and the preconception, prenatal, and of course our Green Choices tools. And if you go to the ANHE website, and if in the block where it says search, you type in assessment tools, it will direct you to the links where you can get these assessment tools. And I highly encourage you to take advantage of these. And thank you very much. Barbara?
Thank you, Sandy. That was wonderful. And there was a question that came up in the chat about how people can access these materials, Sandy, and also whether they have been written in any other languages.
Sure. As I mentioned, go to the ANHE website. It's envirn.org. And when it comes up, there's a search box, and type in assessment tools, and it will take you to that. And yes, the Green Choices tools are both in English and Spanish.
Great. Lovely. And I think that Sarah put the precise URL in the chat. So attendees, if you hover over attendee chat and then scroll down to the bottom, that will give you the precise URL to get you directly into the assessment tools. So you will see them there. And now we've got 9 minutes to open up to your questions. And the ways that we will be seeing your questions is that you'll enter them into the chat. And so I don't think I see any immediate ones other than the one that I just asked. So I think what I'd like to ask is, from the perspective of primary prevention, if we really wanted to start thinking about how we could prevent some of these chemicals from being in our environments, our air, water, food, and our products, what might be some of the ways that nurses and or moms, and maybe there's some dads on this webinar, might approach that? And I'd love to hear Sandy and Alexi, your ideas here, and we'll wait to see if there are other questions that come in as well. Sandy, would you like to start with some of your ideas?
Well, I think that all the exposures are overwhelming. I know when I first started researching to get into this project, everywhere I looked, there were toxic chemicals and toxic this and toxic that. And I felt so overwhelmed. I didn't think I had any power to make a difference. And so kind of paring it down to making it manageable so that you can start looking at the different products that you use. For instance, what are all the chemicals that you put on your body when you wake up in the morning? And, reading them, what the ingredients are, and seeing what are things that I can change about this. Or even looking at what plastics you have and what numbers the plastics are and what are safe to use and what are less safe to use. And so just kind of paring it down so that people think I can do this, rather than why am I even going to bother? It's everywhere. And so I just invite people to, take it one step at a time and to help their clients realize that there are basic things that they can do to improve their health.
Thanks, Sandy. And how about you, Alexa? How would you answer that question?
Yeah, thank you for that. I guess my first thought was really raising awareness. Nurses are the largest healthcare workforce in the world. We have a tremendous reach among the populations. And really, to me, primary prevention starts with awareness, because obviously, if you're not aware, nothing's going to happen, and it's hard to become active as a policy advocate and raise your voice as nurses, which again, I know we say this all the time, but we love it. How many times by Gallup poll have we been identified as the most trusted profession? I think we're at 18, maybe 17. But we have power. We have power in numbers. We have power in authorities. We have power in charisma. We have power in relationships, and if we really activated that power, we could move mountains. But that's this, it's not going to happen if people aren't aware. And I will tell you, as a clinician in a rural community, patients aren't talking about their environmental exposures. And so raising the awareness, as Sandy was discussing, particularly about, I love how patient-driven the assessment, the Green Choices assessment is, and really makes them be active rather than us asking you a bunch of questions and putting them in the EMR. Raise awareness and then educate, provide evidence-based information to your patients so that they can become educated voters and policy advocates. Of course, I work in academia, so with Barbara's help, we're trying to inspire our graduates to become policy advocates and policy makers, run for office, and affect change that way. And I'll end with, I was thinking about this presentation and I thought, well, the real focus of this is to inspire clinicians, thinking of nurse audience, but so glad the community's here, but inspire nurses to reflect on how they're integrating environmental health assessment education into their practice. And I'm going to be honest here. I went, oh, wait a minute. How have I integrated in this my practice? So I right now treat opioid use disorder. Well, that doesn't, I'm not doing maternal, we'd have a significant amount of pregnant women with opioid use disorder, but the focus is at perinatal care. But still, what a tremendous opportunity to bring information to a group of people who could be significantly at risk in this community, as well as inspired by Barbara and this presentation. I've offered to translate this presentation into our recovery and wellness series in our treatment facility that we run for the community. And when I threw that out to the organization, they were like, yes, please do. So raise awareness, educate others, support others.
Great, lovely. I'd also like to chime in here a little bit. ANHE has a policy and advocacy committee. We have nurses that are working directly with the regulatory agencies in Washington. We now have actually for the past 15 or 20 years, have nurses that sit on the EPA's Child Health Advisory PAC. And that's a really place where we as nurses can give direct recommendations to the director of the EPA. Now, obviously, depending on who's the president and who is in charge of our regulatory agencies, that may have more or less impact. And we also have worked with a broad base of chemical safety coalitions around the country. One of the things I want people to know about who are on this call, some of you, this may be new information today. Others, you've heard it lots before and your hair's on fire. You're like done wanting to just change a little thing in a little setting. You want to do something larger. Well, in Europe, in Canada, in many other countries, they have decided that we shouldn't bring toxic chemicals or products with toxic chemicals to the market, that we should do pre-market research on their potential toxicity and not let them come to the market. Whereas in the United States, they come to the market and then maybe we discover they're toxic, and then probably unlikely that we're able to get them banned, because that is just the truth of the matter of our regulatory system. So there are a number of ways that we really need to bump it up into the policy and advocacy. And I recognize, as Sandy said, for some of you, it's going to be bringing it into your individual practice setting. For some of you, it's going to be bringing it into your home and family and making changes. But for those of you who are ready to leap into advocacy, ANHE's Policy and Advocacy Committee is ready and waiting for you to come join them. I see a question here about studies in the prison system, toxic chemicals, and I'm not aware of that. I'm going to ask if Alexa or Sandy know of any studies that were done in the prison system, toxic chemicals.
Well, this is Sandy. I'm not aware of any, but they certainly should be.
Mm-hmm.
We have to do some research on that.
Oh, sorry, Sandy. Yeah, this is Alexa. Fascinating question. Let's do it. Because, you know, when you work in opioid use disorder, that intersects with the prison population, and I would love to learn a little bit more about that.
Yeah, and Kaylin is asking a question here about nurses who work in the, specifically in the hematology, oncology units in the hospitals. And there have been a number of studies that have been done there. The National Institutes for Occupational Safety and Health has an alert for the handling of the chemotherapeutic agents that nurses often have to handle in those units. And that's a place where I think we can continue to work, because what happens is sometimes hospitals get a little bit lazy on that. I'm going to have this be our last question for Sandy and Alexa to chime in on. So this one specifically about children's stillbirths and miscarriages and birth defects associated with working in a hem-onc unit or any other unit where they're working with, for instance, antiviral drugs or other things like that. Would either of you like to chime in there?
Well, this is Sandy. I can't give you a specific one, but I know that there is a lot out there. So I would advise you just to go online and see what studies are out there. The other thing that I recommend, there's a very good book by Sandra Steingraver, and it's called Having Faith. And it is about, she is a environmental health person, and it's about her personal pregnancy and the different stages in her fetal development and all the things that could go wrong and all the chemical exposures. And it's not a new book, but it is pretty amazing, and I recommend it.
I also want to just let people know that the American Academy of Pediatrics just published a new book that are sort of frequently asked questions about pediatric environmental health issues, and that's just coming out right now. So put that on your radar screen. And Alexa, any last words about this nurse's question about working in hem-onc units?
No, I just also say I'd have to myself get into the data. Yeah, and evaluate. It's an excellent question, and maybe something that, you know, we could look at in, you know, to disseminate that kind of information through ANHE.
And thank you. Years ago, I and several, this is Barbara, several nurses did presentation for the Oncology Nursing Society. And we did present that, an overview of those studies. I know they exist. It was several years ago, so I'm not going to try and cite them right now. But that just even doing a Google Scholar search on those issues is going to bring up those studies. And I appreciate the question, Caitlin. And with that, we're just a couple of minutes over. This has been really terrific. I want to thank so many of you for joining us today. It's just delightful to see how many of you stayed with us for this. And please join us for our next webinar, and you'll be getting information on the dates and times and how to register. So have a wonderful day now, and thank you so very much for being with us. Bye now. And Sarah, if you can stop recording, that'd be great.